The nurse cares for a client after a below-the-knee amputation. The nurse assesses for infection and is most concerned if which of the following is observed. Number 1. The client appears restless. Number 2. The client complains of a throbbing headache. Number 3. The client complains of persistent pain at the operative site. Number 4. The skin feels cool proximal to the operative site. So, what is a symptom of infection at the operative site? So, you have to determine what caused each symptom. Does it indicate infection? So, what would be the needed information? Okay. Major complications after an amputation are hemorrhage, infection, and skin breakdown. Monitor for bleeding. So we have to keep tourniquet placed inside at bedside. Skin hygiene is important to prevent skin breakdown. Wash and dry residual limb twice per day. So the correct answer for this one would be number 3. The client complains of persistent pain at the operative site because infection is frequent complication of amputation. So you have to assess for change in color, odor, and consistency of drainage. Increased pain, elevated temperature, so you have to call the doctor immediately. If you answer number 1, the client appears restless, this would indicate hypoxia. And if you answer the client complains of a throbbing headache, this would not indicate infection. And if you answer number 4, the skin feels cool proximal to the operative site, this would not indicate infection. So the right answer will be persistent pain at the operative site. Another one. Propantheline or probenthine is ordered for a patient. The nurse knows that probenthine has which of the following effects on the gastrointestinal system? Number 1, increases bowel motility. Number 2, reduces bowel motility. Number 3, neutralizes gastric acid secretion. Number 4, increases gastric acid secretion. So how does probenthine work? So we have to think about the action of probenthine. So probenthine, this is an anticholinergic which reduces GI motility and inhibits gastric acid secretion. The side effect for this one would be dizziness, confusion, or excitement in elderly, palpitation, dry mouth, urinary retention. You have to give 30 minutes to 1 hour before meals. And so the correct answer for this one would be number 2. Probenthine reduces bowel motility. If you answer number 1, increases bowel motility, Dulcolax, okay, increases motility, contraindicated for patient with abdominal pain. If you answer number 3, neutralize gastric acid secretion, this is what? Antacids such as Maalox or Mylanta. And if you answer number 4, increase gastric acid secretion, probenthine inhibits what? Inhibits secretion. A 72-year-old woman is brought to the clinic by her daughter, who reports that her mother is not eating well but is otherwise healthy. The patient is not taking any medications. The nurse determines that which of the following meals is the best choice for this patient's nutritional needs. Number 1, grilled cheese sandwich cookie tea. Number 2, broiled chicken, broccoli, skim milk. Number 3, raisin toast, tapioca pudding, apple juice. Number 4, liver and onions, decaffeinated coffee, and then jello. So what foods are in a nutritionally well-balanced diet? So we have to think about the type of diet that is needed for an elderly person. So patient with anorexia or poor appetite need nutrient-dense, high-caloric diet. Nutritional well-balanced diet contains foods from 5 basic food groups. These are the milk, 2 servings, meat, 2 servings, breads and cereals, 4 servings, vegetable and fruit, 5 to 9 servings, Vitamins and minerals also needed. Food pyramid, bread, cereal, rice, and pastas, 6 to 11 servings. Vegetable group, 3 to 5 servings. Fruit, 2 to 4 servings. Milk, yogurt, cheese group, 2 to 3 servings. Meat, poultry, fish, dry beans, eggs, nuts groups, 2 to 3 servings. Fats, oils, and sweets, you have to use this as sparingly. So the correct answer for this one would be number 2, broiled chicken, broccoli, skim milk. These are source of protein, vegetable, milk. If you answer number 1, grilled cheese, sandwich, cookie, tea, these are some protein, some carb, and some fluid. If you answer number 3, raisin toast, tapioca pudding, and apple juice, these are some carb and some fruit. If you answer number 4, liver and onions, decaffeinated coffee, and jello, these are source of iron and fluids. So the right answer is number 2, because these are source of protein, vegetable, and milk, which is the broiled chicken, broccoli, skim milk. An 18-year-old woman reports to the health clinic with complaints of dark urine, fever, and flank pain. An initial nursing assessment of the patient would reveal which of the following early symptoms of glomerulonephritis. Number 1, polyuria. Number 2, oliguria. Number 3, polydipsia. Number 4, enuresis. So what is an early symptoms of glomerulonephritis? So we have to be careful. The question asks about early symptoms. So acute glomerulonephritis, group of kidney diseases resulting in inflammatory changes from immunological responses. Signs and symptoms will be edema, abdominal pain, hypertension, fever, and what would be your nursing responsibilities? You have to restrict the patient from sodium and water. You have to do daily weights, INOs, bed rest, high calorie, and low protein diet. So, what is an early symptom of glomerulonephritis? It should be oliguria, number 2, because this is a reduced urinary output, 100 to 400 per day. Also, hematuria, blood in the urine. Proteinuria, protein in the urine. Number 1, if you answer number 1, polyuria, this is an excessive output seen with diabetes mellitus. Normal output is what? Normal output is 2,000 to 5,000 mL per day. If you answer polydipsia, excessive thirst, seen with diabetes mellitus due to osmotic diuresis, and what's the normal for this one? Normal intake would be what? 500 to 2 liters per day. And enuresis, which is what? Bedwetting after age 5. This is not seen. So the right answer would be oliguria, because this is a reduced urinary output. So the early symptom of glomerulonephritis is reduced urinary output, or oliguria.